Here we are with the evidence-based protocol for a grade 1 to 2 hamstring strain. The definition of a hamstring strain is an excessive stretch or tear of the muscle fiber, and there are 3 different grades. The first one is basically just a stretch. The second one is a partial tear, and grade 3 is a full tear. Now for this purpose, we're only going to do grade 1 through 2. Some symptoms you'll experience is during the grade 1, you'll probably just feel a slight twinge, but going into grade 2, you'll feel more of a sudden sharp pain at the back of the thigh or right below the buttocks. You'll feel a painful when extending the knee. You'll experience an altered gait. There will also appear swelling and ecchymosis and tender to palpation. This is common in sports with power, speed, and agility, also activities with continuous strain. These include activities such as track and field, soccer, football, baseball, basketball, tennis, softball, running, jumping, dancing, kicking, weightlifting, skating, cheerleading, climbing, and basically anything that has a quick start and stop. Some common causes are when the muscles are weak and unconditioned before activity, when there is low flexibility, and if the athlete has an improper warm-up or a lack of a warm-up altogether. When the muscle is fatigued, it also happens, and when there is tight muscles, poor technique of the athlete, poor equipment used, muscle imbalances, hereditary conditions, alignment issues, improper gait, aging plays a factor, and when the athlete has poor fitness, poor nutrition, and poor posture. After the injury, there are 4 phases of rehabilitation: the immobilization, progressive resistance, functional, and maintenance. Immobilization is basically when the athlete is immobilized in one way or another, such as using crutches or not able to move it because of low range of motion and whatnot. Braces, surgery, but here it's just what we would want to do for SMART goals is reduce the secondary injury and inflammation of the affected hamstring and compare bilaterally until equal measurement of the course of 3 weeks using the Rice method, Game Ready, and Effleurage daily. I will reduce the pain level on the pain scale by at least 2 points in the first 48 hours by using the Rice method, Game Ready, and compression sleeves intermittently through the next 2 days. I'll have the patient beginning to weight bear and be off crutches by 72 hours by using the Rice method and Effleurage. At least these are the goals to do. I would like to use ultrasound at a non-thermal, alternating 50% duty cycle at a 0.05 intensity for 10 minutes. This will alter the nerve membrane diffusion rate, increase pain scale threshold, and with ultrasound you do not want to use the 100% duty cycle. You will get the heat at that point, and at the bottom there's the thermal therapy in red. You do the same thing. It'll increase the secondary injury because of excess blood flow, and it will go to the inflamed area, and you would just set your patient back, and we don't want to do that. I would next use, what's very important for the hamstring strains, is to immediately use the Rice method within the first 24 to 48 hours. It's very important as far as to get your healing alright on track. With the ice and compression portion, it's great to use the Game Ready and cold compression wraps. With the Game Ready, you could basically use any kind of ice that you have on hand, but what I would like to use best here is the Game Ready at 15 minutes every hour for the first day, and then 15 to 20 minutes every 2 to 4 hours for the next few days. Now, if you don't have a Game Ready on hand, or even you have it once a day or whatnot, use that and then use the ice at 15 minutes every 2 hours or so. And what this does is it lowers the need for oxygen, decreasing the secondary injury, decreasing the blood flow, and reducing swelling and the pain. And what I want to do with the effleurage is elevate the limb using a light milking massage, going from distal to proximal towards the heart, and doing that for 7 minutes, having one hand always on the skin. And this improves the circulation and it stimulates the tissue to force the excess fluid, which is the edema and swelling, forces it towards the lymphatic system, and it drains it and forces it to go in the direction of your stroke. So that's why you always want to go towards the heart and not down towards the feet, because that will make it pool in the wrong area, and then you'll just increase the duration of injury. With the progressive resistant exercise, some SMART goals I want to do are, I want to increase the range of motion of extension by at least 15 degrees in the next 2 weeks of this phase by using ice daily to reduce the swelling even further, and use laser every other day because you want to give a break in between, and using a goniometer to measure and compare the before and after, and also it's very important to always compare bilaterally as well. I want to decrease the overall pain level within 3 weeks through the modalities, and to keep track by using the visual analog scale. And hopefully we want to establish the full weight bearing in 2 to 3 weeks by increasing the blood flow and removing the excess fluid through massage and modalities. Again, you can use Game Ready or an ice pack. Here I want to use the ice cup massage. The massage ice cup massages around the area for 5 to 15 minutes or until the ice melts. This will decrease the sensitivity of the nerve receptors, increases depolarization threshold, and also decreases the pain. Using a laser at this stage, I would use mode 3, which is the 1000 megahertz. There are 3 locations, and it goes from proximal to distal. It goes from the groin to the popliteal fossa and then the lateral posterior malleolus. And it is 2 minutes per location, so that it equals out to 6 minutes per treatment. This increases the ATP synthesis, cell metabolism, and also increases the membrane permeability, which aids in tissue healing. Using the ultrasound, you could use that as well, but I would use it in the later phase because the early phase still has inflammation and you do not want to use the heat in the inflammation. So in the later pre-phase, I would use the 0.5 intensity with 3.3 frequency, which is at 0.3 degrees Celsius, for about 5 minutes and 55 seconds. This decreases the pain, increases blood flow, promotes tissue healing. In the later phase, you could also use any kind of heat. I would like to use the moist heat pack combined with stretching or massage. And you would want the heat pack to be around 160 degrees, placed with a cloth around it to protect the skin from the heat and from burning. And you have it on there for about 20 minutes. You wouldn't want it anymore because the heat just loses it and you're wasting your time. This vasodilates and increases the blood flow and relaxes the muscle sensitivity. Many people in this stage clinically use the contrast water therapy, but they would use it the hot at 105 degrees Fahrenheit, cold 50 degrees Fahrenheit for 20 to 30 minutes treatment, alternating hot for 3 to 4 minutes and cold 1 to 2 minutes. This supposed to reduce edema by alternating vasoconstriction and vasodilation, but why I put it in red is because there is no evidence does not support it. There's not enough evidence at all, and what little there is, it's very one-sided. For the functional SMART goals, we want to restore full joint range of motion. And to do this, you'll compare to the contralateral side using a goniometer and you'll want this to succeed in about 4 weeks of this functional phase through modalities. Decreasing the pain to basically nothing by the end of this phase in about 3 to 4 weeks by using modalities and keeping track with a visual analog scale. Continue to increase flexibility and strength by 5 points a week through modalities, the neuromuscular control, and cardiovascular activities. In about 4 weeks, I would want to have the patient pain-free, mobility-free, and unrestricted participation. To this, we would use the laser at mode 2 for 250 Hz. It is functional strength, and you'll scan the area for about 2 to 3 minutes during the training period only. This will increase the ATP, phagocytosis, protein synthesis, and enzyme activity for the tissue repair. You could use ultrasound for 100% duty cycle at 1.0 intensity, 3.3 frequency for about 6.66 minutes, and this increases the tissue extensibility, promotes healing, increases range of motion. You could also do effleurage still. You still wouldn't want to use the other massages due to the tissue is still trying to heal from being stretched apart, and if you use the muscles, other massages, it'll be deeper and it'll pull that apart and restart the healing process. You'll go distal to proximal towards the heart with a light but deeper stroke for about 5 to 10 minutes, and this will decrease the spasms, reduce muscle tenderness, and increase blood flow to carry the nutrients to the area to help it heal. At this point, research shows to use a dry pack heat for about 20 minutes a day, and you'll do that before activity. This promotes the circulation, relaxes the muscles, increases the joint range of motion, and reduces stiffness. At this point, you could also use crushed ice pack, but you would do it after activities as pain needed, and it would be 15 to 20 minutes a day. And what this will do is it'll decrease the metabolism, minimizing the release of inflammatory byproducts, and it slows the nerve conduction, which allows for a decrease in pain. When reaching the maintenance phase, one is back to normal activities in full, no restrictions, no pain, no nothing. We want to have the athlete maintain the level of flexibility through daily stretching added with heat a couple of times a week. They can maintain full bilateral range of motion through continued exercise, proper technique, and one would be able to measure this with a goniometer. Want them to maintain and not lose muscular endurance by participating in 3 endurance activities a week, and participate in at least 2 exercises daily for injury prevention. In the maintenance phase, one never truly leaves the maintenance phase, and when entering, the athlete has no restrictions, no pain, no nothing. But you can use heat and ice during this phase. Use the moist heat pack and stretching before activity to apply before treatment for 15 minutes a day as needed. This will maintain range of motion and flexibility, increase tissue temp, plastic deformation of collagen plus mechanical stretching will elongate the tissue and keep it flexible. The crushed ice pack you apply after activity as needed is only for minor aches and pains. If too cold for the patient, place towel between the ice and skin for 15 minutes while stationary, or you don't want them moving around or the tissue will heat up. This will cause vasoconstriction. It slows the nerve conduction, decreases the cell metabolism, limits formation of edema, and reduces pain. So to sum up, the hamstring injuries tend to occur during movements involving force and stretch. The first 24 to 48 hours is critical in starting the Rice method, and each rehab phase requires certain milestones before continuing on to the next phase of treatment. Every patient is different and may require different modalities or different parameters. Remember, the goal is to rely on evidence to provide the patient with the quickest, most effective, quality-based treatment of rehab and care.